Hello and welcome to WHO's social media conversation on cervical cancer elimination. My name is Tunga Namjilsuren. I head up WHO's Health Advocacy and Communications Unit in the Department of Communication. Today, World Health Organization, together with communities in countries around the world, is marking the very first World Cervical Cancer Elimination Day, which has been approved by WHO's countries this year. To speak about this challenge and learn about what countries and communities are doing, I have two guests in the studio today. Let me first introduce Dr. Yin Ling Woo from Malaysia. She's a doctor and working as a professor of obstetrics and gynecology at the University Malaya Hospital in Kuala Lumpur. And also I have Dr. Prebo Barango, who's the WHO's lead for Cervical Cancer Elimination Initiative. We had our third guest, Karen Nakavala from Zambia, who is a powerful advocate, a survivor of cervical cancer. She could not very unfortunately join our show today because there are some power outage issues right where she's living. But we are welcoming all of the community advocates and people interested in this topic. Ask questions with hashtag AskWHO on Twitter or X, or on all of our other platforms as comments. So let me start this show by asking Yingling about the real experiences in the communities. You're working with patients, parents every day. What are the most common questions they ask you?
Thank you very much, Tunga. I work in Malaysia, and in the background you can see the KL Twin Towers. And like many countries, we have women from different walks of life, some from the rural area that may not have so much access to healthcare, whereas in Kuala Lumpur, women have access to healthcare. But overall, women still present 50% of them present with late stages, which is stage 3 and 4. Now, we know that in the early stages, those that are detected by screening, they don't have much symptoms, but those who are presenting late, like stage 3 and 4, which is a common situation in countries from lower middle income setting, will have quite a lot of symptoms, such as bleeding, leading to severe symptoms. They have pain in the pelvic region, and occasionally they present with shortness of breath because of the severe anemia and respiratory symptoms such as cough. So these women generally are the sole breadwinner of their families, the sandwich generation, looking after the older generation such as their parents and children. And therefore, usually they neglect their own health, and the symptoms are quite advanced by the time they present to the hospital.
So today, the very reason we are having this conversation is WHO, together with countries, agreed on one of the most ambitious goals for public health of this decade, if I may say, to eliminate this disease by 2030. So I'd like to ask you, Prebo, a little bit on the background. How did this goal came about, and what is WHO's and countries' ambition to reach the target?
Thank you very, very much, Tunga, for that. So the cervical cancer is a disease of inequity. It's something that we've for a long time there's been tools to combat this disease. We know the cause of cervical cancer is caused by the cancer-causing strains of the human papillomavirus, HPV for short. And there has been vaccines that, when administered, is effective in preventing this HPV infection. There's also been effective screening methods to screen women, like Yingling mentioned, that are often asymptomatic, to screen them, and those that have precancerous lesions to be treated of the precancer, thereby preventing them from having cancer. And of course, we also know that early detection of those with symptoms and treating them promptly and effectively prevents death. because these women represent their mothers, they contribute significantly to their societies. So these approaches are there, and because of this inequity, the stark inequity in the mortality and incidence from cervical cancer, the WHO Director General in 2018 issued a call to action that we need to eliminate cervical cancer. And that was the crux of the WHO now developing the global strategy, which is premised on three key pillars. One, vaccinate girls by 15 years with HPV vaccine. Two, screen 70% of women at least twice in their lifetime. And those that are positive or have cervical disease should be effectively treated. 90% of them should be effectively treated. If this is done, modeling has shown that it will place, if this is done by 2030 and is maintained, modeling has shown that all countries in the world will be on track towards eliminating cervical cancer, meaning we'll have an incidence of less than 4 per 100,000. As things are now, some countries actually have an incidence of over 50 per 100,000. So vaccinating, screening, and treatment will help bring down this incidence to such a state that it is no longer a disease of public health interest.
Thank you for mentioning the equity. And just to give a bit more background on the cervical cancer topic. So this is the fourth common cancer among women. And as Dr. Yin Ling mentioned, in many countries, including in her country, Malaysia, women come too late for treatment because there's been very low rate of testing and diagnosis. But the Elimination initiative is partly made possible because we can actually prevent this cancer. There is effective vaccination. In fact, this is seen as the only second cancer that is preventable because of the effective vaccines. So that's why there is a global effort going on worldwide in schools, in communities, in clinics to reach the new generation, the younger generation, girls and boys in many areas, to reach with vaccination so that we can eliminate this disease. So this is actually a very dramatic scene, if you can imagine that the current generation who is getting sick and coming to testing and treatment quite late, whereas we imagine a new generation that would not have to worry about this disease in a few years' time. So I'm coming back to you, Yin Ling, about vaccination. What is the situation in Malaysia?
Well, I'm very proud to say that Malaysia was one of the first countries to ever start a national school-based vaccination program. We were one of the forerunners. We started a national school-based program in 2013, 2010, fully funded by the government and among all our 13-year-old girls. We started initially as per guidelines with 3 doses per girl, followed by 2 in 2016. And now, just last year, our girls are getting a single dose as supported by the recent data. So this is a very exciting time because not only have we started the vaccination program 15 years ago, we are also starting to screen our women with HPV testing. And fortunately, in Malaysia, treatment is available. We have to just navigate access to such care.
This is great news, really taking the lead in terms of vaccination. But I want to go back to some of the women that you are working with on a daily basis. So when you mentioned that they are coming quite late for diagnosis, but what are the typical symptoms generally cervical cancer show? Would people be able to know if they have the disease or not?
Okay, so I treat cervical cancer daily. Now, as with most cancers, we have 4 stages. We have stage 1, stage 2, stage 3, stage 4. In general, the ones that are early stage 1 cancer, they don't have any symptoms, and those are generally detected by screening. Whereas if they become bulky or you go to stage 2, stage 3, stage 4, imagine there's a growth in the neck of the womb and it's getting big. And the organs that are close to it are the bladder, the bowels, and the pelvic region. So what happens is if there's a large growth, women may complain of bleeding in between their periods, bleeding when they have sex, um, bleeding sometimes when they have some effort in urinating or moving their bowels, or they get pelvic pain. Pain when they pass urine and pain when they empty their bowels. So those are quite advanced stages. But if they don't have pain, one of the most common ones would be abnormal bleeding in between periods and after sex.
So, what would be the tests if somebody is worried or if somebody would like to check out? What should they do?
Right, this depends on which country they are from. So I know in many countries there are community healthcare workers, but in our country, such as in Malaysia, we have government clinics, what we call primary care clinics, or with GPs. Now, I want to say that the screening that we're talking about is for women who are healthy and who don't have symptoms. Now, these women should go for screening when they do not have any of these abnormal symptoms. That's why it's very hard to get women who are well to go and see a doctor or see a healthcare professional. Because when you talk about screening, it should be done when there's no symptoms. But if they have symptoms, then they should see a doctor, whereby the doctor will then do a pelvic examination, and often they will use a speculum to look at and inspect the cervix and take a biopsy or take a tissue biopsy. So that's how a diagnosis is made. So we have to make a difference or differentiate screening before the cancer happens and diagnosis for when you have cancer already. So two very different situations. And we are hoping that women would actually attend screening before they have any symptoms.
So that is great. So just for guests and people who are watching us on WHO's various social media platforms, to remind you that today we are discussing cervical cancer elimination. Today it is the very first time the world global community is marking Cervical Cancer Elimination Day. This is an official WHO campaign to be marked on the 17th of November everywhere around the world, as this has been approved by WHO's member countries this year. And you can ask your questions on X with hashtag AskWHO and all of the other platforms. You can enter your questions or comments as comments, and we will be reviewing and calling them out here on the platform. So I'm going to ask a question that has come from I don't have the name, but somebody who's watching us from Pakistan. There are misconceptions about vaccination, and the HPV vaccine still remains unknown by many people, including women, especially in rural settings. So, what would you say to people who are seeing, watching, and maybe hesitating and doubting about the vaccine, about these misconceptions? Perhaps I will start with you, Yingling. Do you see such misconceptions in your clinic with your patients, and how do you respond to them?
We are very fortunate because we don't have a big anti-vaccine a group here, and I think it's been very clear that the HPV vaccine is a vaccine that will prevent cancer. It will prevent mothers from getting it will prevent young girls from getting a cancer in the future. So here we've worked together with schools, with educators, with the religious authorities. So your question is from Pakistan. So we worked with the muftis and the ustas to actually say that this vaccination among girls will prevent them from getting cancers in the future. And to look after the health of ourselves in the future as women is extremely important. So in a sort of interdisciplinary way, Malaysia has done very well to ensure that our girls are vaccinated. So we've even done studies in, we've done questionnaires for teachers in schools. Back in 2010, when I did a survey among the secondary school teachers, while they do not understand the full biology of HPV, they understood that this was an investment made by the government to ensure that our girls will be protected from cervical cancer in the future, and therefore they were extremely supportive. So I think where countries don't have a high awareness, the schools, the NGOs, the educators, everyone can come together to raise the awareness, particularly in a era of social media.
Thank you. Indeed, vaccines, of course, it's very important. And when it comes to young girls, parents, teachers, health workers, they all need to know about the vaccine and be able to communicate. And with social media, we also know that there are a lot of algorithms and there is just a lot of choices of information. So it is very understandable that people have just questions and doubts. And the best line of advice in those cases would be to reach out to health workers and people like Yin Ling, who are actually dealing with real people in real life, experiencing this issue, so that you get reliable, dependable, evidence-based information. So that would be the best, to ask health workers, and also, of course, check the information of the health authorities who have approved information. But it is very understandable that with social media that we would be getting information from everywhere, and for our audience to really be aware which information to use. So with that, I want to come to you, Prebo. We spoke about vaccines, which is happening quite successfully. I understand there are already 150 or so countries that are introducing this vaccine, so that the new generations of girls, women, families, they will not experience cervical cancer as part of these global efforts. And can you please a little bit tell about the vaccine? What is it? And also about the global efforts that WHO is focusing on. Where are the successes and what are the challenges you are seeing?
Yes, thank you very much for that. So first, just to quickly touch on the issue about the safety of the vaccine, WHO has the Global Advisory Committee on Vaccine Safety, and since the vaccine was introduced more than 16 years ago, with over 600 million doses, we know that HPV vaccine is very, very safe. Very safe, and it will prevent infection with oncogenic HPV, and will also thereby prevent cervical cancer. That's one. Now, initially, it started with 3 doses, and Yin Ling mentioned that the progression that Malaysia has gone through 3 doses. And then there was 2 doses, and right now, for the past 2 years, WHO's advisory group on vaccine has actually made the recommendation that one dose schedule is as effective and offers protection as 2 doses for those that are not HIV positive, meaning it provides an opportunity to expand and increase coverage for HPV vaccine for girls. So it provides that opportunity to expand coverage. Like you mentioned, there's been 155 countries in total that have introduced HPV vaccine as part of their routine services. 158 countries, if you include countries that have partially included HPV vaccine. The vaccine is safe, and we've been seeing progress. But globally, we are still not yet at the 90% coverage for HPV vaccine. Currently, it's about 31% coverage globally for HPV vaccine. And we are hoping that with more and more countries scaling up HPV vaccine coverage, we will be able to achieve that 90% target. Thanks.
Thank you so much, Prebo. So our audience may have caught it. So vaccines are there. They are extremely safe and effective. And it is already a great global movement that is happening right now. We should really note on this very first World Cervical Cancer Elimination Day that there are 155, 158 countries that are looking into and introducing, scaling up these vaccinations to young girls and women. But at the same time, we have a long way to go to achieve the global goal of achieving 90% coverage. At this moment, it's only just about 30%. So we need everybody's support, everybody's sharing and learning and educating each other about cervical cancer so that we can really maintain and benefit from this global effort. So I'm going to ask a question that's come from one of our members of the audience. So there are actually several really interesting questions. Let me ask maybe with hopefully a specific one. Amanda is asking how many strains do the HPV vaccines cover? So the virus may have several different, many types, of course. So the vaccine, how effective would be against the different strains?
I'd love to take that question because it will then emphasize the importance of screening. Now, we know that there are about 35 types of HPV that affect the anogenital tract, but only 12 are significantly associated with the development of cervical cancer. So when we look at the current vaccines that are available, they cover most of them. So there are two main vaccines that are available in the market. One that covers the two oncogenic types, which is type 16 and 18, whereas we have the 9-valent vaccine that will cover 7 types. This means that for even for the vaccinated population, while you can prevent 90% of the cancers when they become older, when they become adults, there's still a small proportion of women that are still at risk of developing cancer, and hence vaccination alone is not a foolproof method. While it may significantly reduce it between 70 to 90% incidences of cervical cancer in a country, it will not totally eliminate the need for screening or eliminate the incidence of cervical cancer. So to answer Amanda's question, there are 3 common ones. One which covers HPV 16 and 18, and the other one that covers 5 additional types. So the vaccines that cover 16 and 18 will prevent 70% of cancers, whereas the other vaccine that has an additional cover will prevent 90% of the incidence of cervical cancer. I hope that answers Amanda's questions.
Thank you so much for that. I also have a question from Hang Sawanara, and Yingli, you may answer, or Prebo, you could add to that. So the question is how to explain HPV infection transmission. Mostly or people debate it's from husband or from sexual partners, or some say it's from hygiene. And there is also advice screen together with the husband or the partner. So can you explain the transmission routes?
This is such an important question to answer, and I thank you for that question. Essentially, HPV infection, we need to understand the first thing is that it's a very common infection among men and women. Very common infection. In fact, we know that 90%, 80 to 90% of men and women at some point in their lives are HPV positive. So it's it's contracted by sexual interaction. It's a sexually transmitted infection. But we don't consider it a sexually transmitted disease because it doesn't cause vaginal discharge. It doesn't cause infertility. It doesn't cause any pain if it's just an infection. Now, what we understand now is that our immune system plays an extremely important role in controlling the infection. And therefore, for most of us who have been exposed to HPV infection, if their immunity is weak, for example, Prebo said that, for those with HIV, they need 3 doses of vaccination. We know women living with HIV have 6 times higher risk of cervical cancer. This just shows that the immune system is so important in controlling HPV infection. So we would say HPV infection is common. It is acquired by skin-to-skin contact, most commonly by sexual interaction. When we say skin-to-skin contact, we really need microabrasions on the skin. Do you know that it is nearly impossible to grow HPV on a petri dish? You can take swabs, you can take anything, but you cannot grow HPV on a petri dish. It is so difficult for HPV to actually multiply itself. It actually needs the skin, the machinery of a differentiating skin, or what we call the epithelium, for HPV to replicate, which means that even if I suck in HPV by air, I touch HPV, I cannot get an infection through contact, through poor hygiene, through all those ways. This is so important. It is not an airborne infection. It is something that is transmitted skin to skin with microabrasion. I hope that answers the question because it's quite a difficult concept for people to grasp, and therefore it's associated with so much stigma.
Yes, correct. So the part of the question was also a little bit about, so do we need, is it advisable to do couples testing, or is it necessary that the other partner, sexual partner, tests for this infection?
The answer is no. The reason why we test for HPV is that we are identifying the risk of developing cervical cancer. We're not testing for an infection. We're not performing a sexually transmitted disease panel. So, for example, if someone young comes in and says, "Oh, I want to have a sexual infection panel such as chlamydia, gonorrhea, HIV," we do not include HPV there because it is not a disease that we want to detect. What we want to do with HPV screening is to look and identify the risk of developing cervical cancer in individuals with a cervix. So in male partners, we don't need to screen them because have we don't have a means of detecting pre-cancer. It is a common infection, which most of the time it doesn't lead to anything. Can you imagine? The studies have shown that if you screen men that are healthy, up to 70% of them will have HPV in the oral cavity, in the anogenital area, but it's not disease. But what do you do with all these anxious men then?
Thank you. That's an interesting question, but it's such a complex disease, and there are many people who would be affected, but it's also very specific, the fact that we focus on women, and when it comes to vaccination, the priority on girls as well. So hopefully with the start of the World Cervical Cancer Elimination Day from today onwards, there will be a lot of conversations around the world in different languages, in different communities, in families, about this disease, so that we understand it better, starting from individual actions we could take, but also, reminders and for other people in our families, because it is quite different, and I think we are quite early in our conversation. Thank you for that. And I want to call out one more question, but I also miss, of course, Karen Nakavala, who was supposed to join us from Zambia, because she set up an NGO called Teal Sisters, and she is one of the formidable survivors and champions and advocates, amplifying the voices of women and survivors of this cancer. But she couldn't join because of the power outage in her community at the moment. But if there are other experiences that our audience, of course, on X, you could add. The question I have for Prebo, it's again one of the people who are watching us, Ankita Vasnik on Facebook was asking how can we as NGO get involved in this work? And I also see another question on the screen from another member of the audience. Civil society should be key in this global effort. And what is WHO's advice? Prebo?
Yes, thank you very much. Civil society organizations and advocates and non-governmental organizations are actually key because they are closer to the grassroots, and they also are able to hold governments accountable. So their role is diverse, and what they can do there is from organizing screening campaigns to marches, to raising awareness campaigns, having competitions with engaging with schools, providing correct information to teachers, to schools, in terms of like we mentioned now on vaccine safety, raising awareness on screening, what the misconceptions about screening, and ensuring that this is taken up at scale. Also raising awareness on vaccine. Today is World Cervical Cancer Elimination Day, and we've had those several other NGOs. Some are supporting lighting up key monuments in different countries in teal, which is the color for cervical cancer elimination, holding debates, and also ensuring that governments and starting that conversation with governments and the communities on the need and the value of eliminating this disease that is very common, and it's easy to it's a low-hanging fruit. So the role of civil society organizations, like the one Karen is leading, and the ones that several other organizations in all the countries of the world are doing, is key. We have an informal partners platform where we meet with with cervical cancer elimination partners that range from vaccination to screening and treatment, and even patient support. And it's a platform where they are able to provide support and look at what is happening globally and see how they can key into this global movement. So NGOs are key to maintaining the momentum for this global movement. Thank you.
Thank you for that. So the message to all of the community members, and if you are representing a civil society group, your country may be one of the nearly 160 countries that have already joined this goal, working to eliminate cervical cancer by 2030. Even if not, you can join all of the global discussions. There is WHO. You can also engage your ministries of health, your local health authorities, health clinics, doctors like Yin Ling, who are working with community members every day to learn more about this effort and really join this work. There are many opportunities. I would like to ask you again, Prebo, just to state for our audience once again that we have this goal by 2030. The goals are 90, 70, 90. Right now, this is an amazing global effort. There's a lot of commitment that have been made by countries. We should acknowledge them on the very first Cervical Cancer Elimination Day. But what is exactly the coverage rate towards these targets so that we know what needs to be done?
Thank you. So there's been a lot of, there's actually a lot of optimism that we are making progress. We are making progress in terms of screening. Like I mentioned, more than 155 countries have introduced HPV vaccine, and there is need to scale up to other countries. We also know that screening for women, the 70 target, is actually the one that is worst performing. And in most LMICs, screening is still using visual methods that are not high performance, meaning that they have low sensitivity and specificity. So the encouragement and the guidance is that countries should adopt and adapt using high performance tests such that the HPV DNA self testing offers. And this HPV DNA has the advantage that it also has a self-sample collection option, so that women do not necessarily have to go to the clinic and get an internal examination by the clinician to screen for HPV. They can collect the sample themselves and then provide it to the healthcare worker. This frees up the time of the healthcare worker, and also ensures that women can do this screening in their privacy if they so choose, and healthcare workers are able to now put enough time to only examine those that need to do it. For screening, the coverage is quite low in several countries, and we are supporting countries in terms of seeing how they can scale up, particularly using high performance tests for screening. Treatment capacity is also low and lowest in most LMICs, and the challenge for this is basically the challenges for the health systems in terms of pathology services, in terms of medical professionals for oncology experts in several low and middle income countries. These are lacking, and there are efforts to ensure or look at mechanisms to support, maybe through South-South collaboration, to see that countries are able to support each other in scaling up treatment. But like I said, treatment, the coverage is really it's low, and there is room for us to make progress. Thank you.
So there is so much more to be done, and everybody's support is needed in this effort. So I'm coming to you, Yin Ling. You already are as you said, we are lucky in Malaysia. You are one of the champion countries of this global effort, and showcasing what can be done and how can be done, and bringing in more partners. But what would be your call to action today to everybody who's listening us, but also all of the other decision makers in other countries?
I want to say that beyond the action of governments, the responsibility can lie on us to accelerate the effort to vaccinate and to screen and to treat. As Prebo shared, the elimination target is not going to be achieved by 2 pap smears or 2 visual inspection. It is with 2 HPV DNA tests in a lifetime. So we need to ensure that women will have access no matter where you live. 70% of these women will have access to HPV testing. I remember before this call that we were chatting, Karen said she was going to attend a meeting at the World Bank, and she wants to ask this question: how do we get enough funds? How do we ensure that women, no matter where they live, will have at least an opportunity to have an HPV testing? And I think we should ask this question very seriously. As a global society, how do we ensure that 70% of women if not twice a lifetime, will get at least one HPV test in their lifetime. That is what I'd like to say. And treatment. Many countries still do not have a radiotherapy machine, which is the main way to treat advanced cancer. And so we need to ensure that equity can be corrected if we were to achieve the global elimination of cervical cancer.
Thank you. So in our lifetime, but also in just a few years. So that is the global goal, to eliminate cervical cancer by 2030. And there's really a lot could be done, because there are tests, there are treatments, and most importantly, there is a way to prevent a whole new generation of women, girls, and families to prevent from this type of cancer. This is currently the fourth common cancer that women are experiencing. So this is our challenge of our time. So we really appreciate everybody joining today's social media conversation. Just to state a few countries where people have joined and asked questions: Trinidad, Tobago, Azerbaijan, United Kingdom, France, Australia, Nigeria, Pakistan, Ghana, Iran, Indonesia, Uganda, Thailand, India, Malawi, Vietnam, Kenya, UAE, Djibouti, and many other places. Thank you so much. This is WHO's social media conversation dedicated to the very first World Cervical Cancer Elimination Day, which will be marked every year on the 17th of November. Please spread the message to conquer this preventable cancer. Thank you so much to my guests, and thank you for everybody who watched us today.
Thank you.
Thank you.
Thank you very much.